The Minister of Health, Dr. Osagie Ehanire, says records show that 10% of all positive COVID-19 cases treated are below the age of 19 years. Ehanire made this disclosure at the daily briefing of the PTF on COVID-19 in Abuja. According to him, with regard to COVID-19 and growing complacency, it is important to stress that even though adults, especially those 60 years and above, are more vulnerable, complications do occur in all age groups.
With regard to COVID-19 and the growing complacency in our country, it is important to stress that even though adults, especially the vulnerable with other comorbidities, and persons 60 years old and above are the most vulnerable, complications can occur in all age groups, and there have been fatalities even of children. Records show that 10% of all the positive cases we have treated so far are under the age of 19 years. But many of these are also the very mobile group that are without symptoms, and they can therefore easily spread the illness even without knowing it. Therefore, as schools begin to reopen in some parts of the country, I want to urge caution and adherence with protocols and advisories for reopening schools as circulated by the Ministry of Education.
Speaking on the need for testing, the minister noted that it was important for the country to generate national and international confidence in the nation's data by conducting more targeted testing before conclusions were drawn.
It is important for us to generate national and international confidence in our data by conducting more targeted testing before we draw conclusions. It means that we urge all states and local government areas to cooperate with NCDC by increasing their sample collection rate using the criteria listed, to increase test options to a desired rate, and also to report promptly, as we are still far from the target of 2 million tests which we spoke of. In this regard, we can support states with community volunteers for contact tracing, case finding, and investigation. While stepping up surveillance and case finding, states can also ensure that suspected symptomatic COVID cases are sent for treatment in time or supported with medical oxygen to save lives and reduce fatalities. The criteria I mentioned, which are recommended for testing, are persons who have been in contact with a known COVID positive patient or person, or people who are associated with a cluster of persons of interest in COVID tracking, or those who have any of the 4 classical symptoms of fever, breathlessness, persistent cough, loss of sense of taste or smell. Also, anyone facing surgery needs to test, as well as any other person who has a compelling reason to test. Those testing for travel are left to use private laboratories.